doctor-physician relationship and maybe what you know of the public versus private sector? I mean, you mentioned that there's almost little to no line in the private facilities, so maybe is there more interaction with the physician? Do you typically see more than one physician
Yeah.
at a time, or within one visit, or?
Within one visit, not necessarily, but the physician you will have a bit of a personal relationship with, he will then recommend that you, like a lot of doctors do, that you follow up with this other doctor, that you look into this and this other thing and that. So you're going to leave with like 5 exams, and then once you do all of them with all these different doctors, you're going to bring him back to this one guy who's going to look it over and says, yeah, you're good. You have nothing.
Do you think that happens in the public?
No. They don't have the resources, and a lot of people don't have the time to follow through with all these things. Preventive care in this sense is much more prevalent in the private sector and among wealthier patients. People, I guess, will only really use the public health system when they really need it, when they need to go to an emergency room, and then the relationship's going to be very different because you have one doctor running around trying to attend dozens of different patients, and there's going to be very, very little relationship there.
So do you have any, I'm not sure how many of your friends from high school went abroad for school, but just out of curiosity now, do you have any friends going through like the pre-medical education route? What is that like in Brazil?
To get into university, it's because we don't have an undergrad. You kind of just go into med school.
Okay.
So that's the most competitive admissions process in Brazil. So it's going to be incredibly hard to get into. Just, almost suicidal. But once you get in, I think it's very similar to the way the US works.
Okay.
It's a little bit shorter actually. I think because of the lack of undergrad. But you do have, medical school, and then you have to do your residency and then your specialization.
Yeah.
But they are very similar. But very demanding. Very demanding. So in São Paulo and Rio, there's going to be a very high concentration of physicians per, 1,000 residents or something. And that's a number that's comparable to a number of other rich countries. But once you get out of those cities and you go to the northeast, the northwest, where there's, really nobody there, the quality in care drops significantly, and the number of people who can attend the patients. And I don't have an answer to that. I don't think flying in doctors is the correct solution.
Because then you also have physicians such as the one that we interviewed who received his medical schooling in Brazil and practices here. So you kind of have this two-way sense of mobility.
Yeah, no, but flying in doctors doesn't seem like it really fixes the issue. It's kind of like you throw toothpaste on a hole in the wall instead of actually like filling it in with plaster. The more sustainable route would be to improve your education system so that you produce your own doctors and you don't have to import them. And then again, how to get those doctors to go out into the less populated areas, I don't really know how to do. How do you create those incentives? Maybe with better pay, definitely with better care.
That's solve Brazil's biggest problem.
But the article that I sent you also mentioned something about nurses, which because of lobbying from like a number of special interest groups, they have significantly less power than they need. So they can't, for example, prescribe medication Only doctors can do that. There are also too few of them compared to the number of doctors, so there need to be a lot more. Those I see as direct, very immediate solutions, which could go a long way towards resolving the issues.
Okay, so going back to kind of like the distinction between the private and the public care, do you think that people in Brazil view quality health care as a citizen's rights, as something that they inherently should have a right to?
Yeah. Yeah, it's very.
Despite the inequality, I guess.
Yeah, I think most people accept that there is going to be a difference between public and private, but they do believe that everyone is entitled to, as a universal health care, and at a good quality, at a standard which we don't have in Brazil right now. So pretty much anyone in Brazil would advocate for a better, for better healthcare services, and as a result, better health insurance that will provide for that. But the way things stand in Brazil now, it isn't a question of lack of spending so much as bad spending. So there's a lot of inefficiencies in the way the government does it, and a lot of corruption, a lot of like lobbying and stuff that really screws over the average patient on a day-to-day basis. So again, theoretically, the health care we pay now, the health insurance we pay now should cover the expenses.
Yeah.
If the money were just better allocated.
Because now I guess through the Affordable Care Act, like Obamacare, we're now opening the opportunity for health accessibility to places that are people who don't previously have like access to like health insurance, and in that way it's becoming more like universal in the sense that Brazil technically is. But so it's interesting how they're have the same goal, and I think the difference though is like culturally, I don't know if everybody in the U.S. would say that health is a human right, because they don't want to pay for it.
If in the U.S. they're pissed that they're paying for other people's health care, in Brazil they're pissed that they're not paying for anything at all. So they're paying taxes that are supposed to go to paying for healthcare, and it's not helping anyone. They're not getting anything out of it. Other people aren't getting out of it. Other people are dying, and pretty much everyone in Brazil is aware of the situation, and they're all very indignant, but they don't really know what to do. In June there were the big protests, and everyone was demanding reforms in healthcare and hospitals to FIFA standards, but they can just ask for these things really, really loudly and not really know how to get them.
Yeah.